Hello, my name is Grace, and I'm about to perform a health assessment of my own work. I have my supplies set up over here, and normally I would wash my hands before a patient comes in. At this point, I'd like to invite my patient in. Hello, my name is Nurse Grace, and I'll be doing your health assessment today. Go ahead and take a seat. You could go ahead and tell us your name, your age, and your occupation.
My name is Grant Fox. I'm 21 and I'm a student.
Okay, and could you also tell me the date, the location, and your reason for visiting today?
The day after Thanksgiving, Maryland's location, and I'm just getting a checkup.
Okay, thank you so much. And is English your native language?
Yes.
Okay, so right here we have a 21-year-old Caucasian male, alert and oriented ×3. His hearing appears to be grossly intact due to his answering the questions articulately and appropriately without hesitation. His skin appears overall warm, dry, intact with no apparent lesions, but we'll go ahead and do a more thorough skin assessment later on. He is well nourished and well developed. His gait when he came in was smooth and steady, had no assistive devices, and his range of motion seemed to be intact, but we will go ahead and assess the musculoskeletal system later on. He exhibits good hygiene, and he's dressed appropriately for the occasion. His mood and affect is calm and pleasant, which is congruent and appropriate for the situation, and his posture is erect. So at this point, normally what I would do is I would take his vital signs, but for the sake of this video, we're going to go ahead and just skip that. What we're going to do is go ahead and actually take his pulses. So I'm going to move over here. Grant, I'm going to assess his temporal artery up here and check for just circulation and overall pulsing here. It's a good +2, and I normally do both sides bilaterally, but I'm just going to go ahead and do one side here. I'm going to assess the carotid. I would never do both sides at once because I wouldn't want to occlude the blood flow to the brain. Okay, good +2. And go ahead and do the brachial here, brachial pulse. And that's one nice and strong, +2 there. Okay, I'm going to do the radial pulses here. Good +2 here. Here as well. Normally I would assess the femoral, but for the sake of privacy, I'm not going to go ahead and assess it, but it would be right in between here. You would assess right in the groove by the groin. You can usually teach your patient to assess that on themselves. And if they have good blood flow further on, you can just assume that he's getting proper blood flow. The popliteal here, behind the knee, sometimes is not accessible in a normal adult, and I'm not really finding it on him. But I'm going to go ahead and move on to the pedal pulse of the dorsalis pedis as well. Can I take off your sock? And to assess that, you take 2 fingers and lightly touch over on the top of the foot here. And sometimes it can be difficult to find, but there it is. And also here behind the ankle. Good. You got good +2 pulses all around, Grant. All right, so I'm going to put your sock back on for you. Okay, Grant, so at this point, what I'm going to do now is go ahead and just knock out the cranial nerves. I do it in this way just because it makes sense to me to just knock them all out at the beginning. So first one, the first cranial nerve, the olfactory nerve for the nose, cranial nerve 1, is not routinely assessed in this type of scenario, but what I would do if I were to assess is to have him occlude each nostril independently and then bring common smells like coffee or peppermint and see if you were able to identify them one nostril at a time. For cranial nerve 2, this is going to assess the acuity. So what we're going to do, I'm going to move over this way, go ahead and scooch over and get my little Jaeger card here. So what you're going to do is you're going to take this about 12 inches away from your face. Okay, Grant, and what you're going to do is you're going to tell me if you can read this last line here, okay?
428739.
All right, good, and that's about 20/20 vision, so that's good. Next, we're going to do what's called the confrontation test. So we need to sit facing each other, and you're going to take this card, and I'm going to take a card, we're going to put it on this side of our eye, okay? And what you're going to do is you're going to tell me when I move this pen at what point you can no longer see the pen, testing your peripheral vision.
What is the purpose of that?
It's a screening for glaucoma, which a decrease in peripheral vision can sometimes be a screening for that. All right, so go ahead and block the vision here, and just tell me when you can no longer see the object.
Gone.
Okay, good. It's about the same time as me. So assuming that I have normal peripheral vision, his would also be normal as well. So go ahead and move to this side. Same thing, tell me when you can no longer see this black tip, okay?
Gone.
All right, good. Awesome. Okay, so that's good. He has good visual acuity, a good confrontation test. Next one, we're going to go ahead and assess cranial nerve 3, 4, and 6 by doing the cardinal gaze and the perla to test his pupils to see if they're equal, round, and reactive to light. And one thing I wanted to say with the confrontation test is normally what you're looking for when you move the object out of the way is typically people have 50-degree superior view and 70 inferior, 90 temporally, and 60 nasally. And I don't have any way to measure that right now, but that's what normal findings would be. So to test the pupils, I'm going to shine a light into them. This is testing for cranial nerve 3, 4, and 6. And see if his pupils react to the light by constricting. So go ahead and stare straight ahead over here. Okay, this one good, reacts. This one constricts as well. I'm going to go ahead and block this side from seeing and see if we have, if this side constricts as well while this side does. Good. They both constrict at the same time. We'll go ahead and check this one as well. So even though this one isn't receiving any light, this one is constricting at the same time as this one. They're doing it at the same time. To test accommodation, you go ahead and stare straight ahead of my finger. Bring it in. His eyes should go in together and constrict. And that's exactly what they do. So that's good. So his pupils are perla. Turn this off. All right. All right, next we're going to do the cardinal vision, cardinal gaze. Where did I put my pen? Oh, here it is. All right, so what we're going to do is just going to have you follow this pen in all the directions that I point, okay? So I'm going to start here and go up this way. And I'm looking to see if there's any nystagmus, which is the shaking of the eyes, and I'm not seeing any. Sometimes it's normal to have brief periods of nystagmus on the far lateral, but I'm not seeing any of that. Both of his eyes are following, no hesitation altogether. Some people like to do it this way. Some people like to do the H pattern. And that's assessing the cranial nerves 3, 4, and 6. Next is cranial nerve 5, which is trigeminal. So what you're going to do, Grant, is clench your jaw together, and I'm going to try and separate your jaw, but don't allow me to do that, okay? Okay, good. He's got a very strong jaw. Okay. For cranial nerve 3, 4, 6, 5, 7 is the facial nerve, so he's going to do, I'm going to ask him to make some faces. Go ahead and puff your cheeks out. Okay, good. You can relax. Raise your eyebrows. Smile. And give me a frown. So good. He's got good motor function of facial nerve. I'm going to go ahead and test sensation. So go ahead and close your eyes. I'm going to do light touch. And you just say now when you feel a touch on your face, okay?
No.
Now? Okay.
No.
Good?
No.
Good? I'm doing 3 different sections.
No.
Okay?
No. No.
Good. And I waited a little bit longer just to make sure he wasn't just getting used to my rhythm. All right, you can go ahead and open your eyes. I'm also going to go ahead and test your extremities. I would normally do the feet as well, but for the time's sake, I'm just going to do the hands here. So I have a dull side of this paper clip and a pointed side of this paper clip. And you're going to close your eyes, and I'm going to touch either side, and you tell me if it's pointy or dull, or sharp or dull. Okay, so go ahead and close your eyes.
Dull.
Dull.
Dull. Sharp. 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 Sharp.
Okay, you can go ahead and open. The reason why we do this is when we're testing the neurological function, which is of the cranial nerves, this isn't a part of the facial nerve, but I just wanted to go ahead and do this while we're at it. It's testing for any diseases that affect the neurological status, which like diabetes. And the reason why I started with the fingers and moved up is because usually those diseases affect distally to proximally. So that's why it's better practice to start distally at the fingers and move your way up towards the extremity, or towards the proximally. So now I'm going to go ahead and do the light touch. You just say now when you feel it. So go ahead and have your eyes closed. I don't have a cotton ball, so I'm using this little piece of gauze.
No. 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 No.
All right, good. He has good neurological sensation. I just wanted to kind of knock that one out as I'm hitting the facial nerve as well. Next cranial nerve is cranial nerve 8, which is the hearing. So what I'm going to do is I'm going to step about 2 feet away. I'm going to whisper 3 letters and numbers, and you're going to repeat what he hears. So I'm going to say 3 things, and you repeat them after me, okay? So go ahead and close that one ear on the other side. You ready?
12.
7.
7. W.
Good. And I said 12, 7, and W, which is what he repeated. And normally I would do both sides as well, but just for the sake of this video, I'm just going to do one side. Alright, so 8, to assess cranial nerve 9 and 10, what I'm going to do is I'm going to take this tongue depressor, and he's going to say, ah. And when he says ah, his uvula and his palate raises midlines. That's showing good function. And also, I'm going to go ahead and open up again. Open up. Put your tongue out. Okay, good. I just assessed his gag reflex, which is assessing the vagal nerve, cranial nerve 10. So he has good gag reflex intact. For cranial nerve 11, we're going to go ahead and assess the accessory muscles here. So what you want to ask you to do, I'm going to put pressure and try to shrug against resistance. Very strong muscles there. Now try to turn towards me. Good. Turn. You're good. Very strong accessory muscles. And for cranial nerve 12, it's the tongue movement. So go ahead and stick your tongue out. And when you stick it out, notice it is straight. It's not curved to one side. It's midline. Try to put your tongue to the left, to the right, up, and down. Okay, so that's all good. Next, we're going to move from the cranial nerves, and now we're just going to do a broad skin assessment. So we did a little bit with the initial general overlook, but I'm going to go ahead and just assess the rest of his skin. Looking at his arms, all of his arms are warm, dry, no evidence of cyanosis or diaphoresis, no lesions, no bruising, bleeding, anything like that. He's got good skin turgor here. No evidence of dehydration. Go ahead and look at your nails. They're smooth, round, flat. No evidence of clubbing. His angle of his nails is about 106 degrees. His good oxygenation. Lack of oxygenation chronically could lead to clubbing. Let's see his cap refill. Is brisk and immediate, less than 2 seconds. I would also check the feet normally. Let's see. We'll go ahead and check this other arm here. Okay. Check your legs. Hair's equally distributed. No patchiness or anything like that. And do you feel any pain or tenderness or itchiness or anything like that? Any rashes you're worried about? No? I just go ahead and do a general skin assessment so I don't have to worry about it later. I'm going to go ahead and check your... Let me turn this... Oh, let's get this one. Check his back here. Back is clean, dry, smooth. Good turgor here. Pink tones. No dry skin or anything. We'll go ahead and check your chest as well. We'll look at this all more further in depth when we do all the regional assessments. Okay, pink, good musculature, hair evenly distributed. You can go ahead and put your shirt down. Okay, next what we're going to go ahead and do is look at his head, his face. So I'm going to go ahead and you let me know if you feel any tenderness or anything when I'm feeling your scalp. Okay, your scalp is nice, no receding hairline, full thick hair, no protrusions or lumps or anything in the head. Any tenderness? No protrusions. His head is normal cephalic. I'm going to go ahead and feel your sinuses, okay? This is your frontal sinus. I'm going to feel any tenderness. No? Have you been having any problems with sinus pressure or colds or anything?
Mm-mm.
Okay, this is the maxillary sinus. He's got other sinuses, but they're not really palpable. Good facial hair. I'm going to go ahead and look at his His trachea is midline here. There's no deviation, which could indicate pneumothorax, but he doesn't seem to have that. I'm going to go ahead and, what I'm going to do now is going to go ahead and look at his lymph nodes. So if you could turn just a little bit this way. Okay. Here you would feel submental. I'm not feeling anything. They should all be non-tender and mobile. This one is submandibular, preauricular in front of the ears right here, posterior auricular behind the ear here, occipital, jugular digastric underneath the ear, superior cervical up here on the neck, posterior cervical just behind the muscle here. The deep cervical chain are all the ones on the neck here. And then supraclavicular would be up here. And did you feel any tenderness on any of these lymph nodes? And I didn't feel any hardened ones or any overly large ones or anything, so you shouldn't have any lymph problems. I'm going to go ahead and check your thyroid now, okay, Grant? So just back up this way. Okay, so for this one, what I'm going to do, I'm going to put my hands around his neck like this, around the muscle, displace the thyroid to my right. I'm going to ask him to swallow. So go ahead and swallow. Okay, good. I felt it rub against this side. I didn't feel any lumps or anything. I'm going to do the other side. Squeezing in. Turn this way so the camera can see a little bit. Okay, I'm going to wrap around the sternomastoid here. And I'm going to displace it now to the left. Pushing it. Now go ahead and swallow. I know it's hard to swallow. I felt it pass down when he swallowed. I didn't feel any lumps or any nodules. If I did, I might be worried about thyroid tumor or anything like that, but I didn't feel anything, so that's good. All right, go ahead, and I'm going to go ahead and assess your nose. Okay, Grant? The external nose is midline. The skin is intact. No excess puffiness or redness, so no sneezing or anything like that lately. Okay, I'm going to go ahead and use my speculum here. Turn it on. Okay, so I'm going to go ahead and lift up his nose like this and look inside. And I'm not seeing any edema or anything like that. No bleeding, no discharge, no swelling, no foreign body. The superior turbinate is not visible, but the inferior and the middle are visible. They're pink, vascular. And look at the side as well. Okay. The septum is not deviated. I'm going to go ahead and occlude this nostril. Can you breathe in? Okay, I'm going to occlude this nostril. That's just assessing the patency of his nose. He's not having any trouble breathing. Okay. I'm going to go ahead and move on to now the mouth. So go ahead and move to this side. Get my glove on over here. Alright, Grant. It's a little stuck. Alright, go ahead and open up your mouth. Well, first I noticed that his lips they're not dry or cracked or anything like that. Look at his teeth. They're white, evenly spaced, very clean, no evidence of debris. And I would also give some patient teaching here about how often to brush the teeth and flossing. Go ahead and open it. I'm going to lift down. His gums are pink, no swelling, no redness, no inflammation, no evidence of any gingivitis or anything. Down here is also pink, so that is good. Go ahead and lift your tongue up. Very smooth and shiny and vascular with the blue veins. You can put your tongue down. Stick your tongue out. It's pink and a little bit rough, a little bit of white patches, but that can be normal. Okay, go ahead and open up again. There's no lumps or anything inside of his mouth. The buccal mucosa is pink and warm and moist. No evidence of any lesions or bleeding. I'm going to go ahead and get my tongue depressor. Go ahead and say ah. I'm going to go ahead and get my light also so I can look at the tonsils. Okay, the tonsils are visible, but they're not protruding very far, so I would classify them as a +1. I'm going to go ahead and see if I can see the Stenson's duct. The Stenson's duct is opposite the second upper molar, and it is the opening of the parotid salivary gland, and I can see it right there. That's good. Go ahead and close your mouth. Go ahead and put this down. So far, so good. All right. Next thing, I'm going to go ahead and, let's see, did I do your ears? No, I'm going to do your ears. Take this off. All right, Grant. I usually would do both sides, but again, I'm just going to do one side for the sake of time. So on him, I'm going to look at the exterior of the ear. The color is congruent with the rest of his face. No lesions, no bleeding or anything. Is there any tenderness when I press down on the tragus? No tenderness here. Any history of ear infections lately? No? Okay, when I look inside the ear, I'm going to use the biggest speculum that fits. I'm going to pull up and back for an adult, and I would pull down for a child. I'm going to pull up like this and look inside. And I'm looking for the tympanic membrane. And there's no evidence of any cerumen or foreign body, and I see the tympanic membrane in there. It is pearly gray, no evidence of any distension or anything, no scar tissue, and the light reflex is about 5 o'clock, so that's good. Okay, at this point we're going to go ahead and assess his eyes. Okay, Grant, so what we're going to do is check your corneal light reflex. What this is going to do, I'm just going to take this light here and shine it in your eyes to make sure that the light is reflected equally, okay? Turn this light on here. Just stare straight ahead. I need to... Okay, so what I'm seeing here is that the light is shining equally on the same spot of the cornea, which is showing that there's parallel eye axes and that the cornea is smooth and rounded with no abrasions or anything like that on there. Assess your eyebrows. His eyebrows are, the hair is equally distributed, they're symmetrical, they're even. His eyelids, let's go ahead and open them up. They slightly overlap the superior part of the iris, which is a normal finding. His palpable fissure between his two eyes, they're equal and they're horizontal. His lashes, the hair is equally distributed. Let's see, the balls of his eyes, there's no swelling or edema. They're not protruding at all, so that shows an absence of exophthalmos, which can be a common disorder with the thyroid. The sclera of his eyes are white. There's a little bit of redness, but I know it's probably from staying up late helping me with this video. So his iris is a nice green color, and his pupils are, I would say, about 3 or 4 millimeters, which is a normal finding. Now what I'm going to do now is get out my ophthalmoscope and check your, to look at your retina, okay? So all you have to do is just look straight ahead, and I'm going to go ahead and look in your eye, make sure that it's calibrated here. So what I'm looking for, as I go across, is look for the red reflex first. Just stay looking across. I'm starting about this far away. Okay, I've captured the red reflex. I'm moving closer until I find a vessel. Alright, and I found one. I'm moving a little bit closer here. Alright, so his disc is an orangey pinkish color. The vessels are there's no AV nicking, so that looks great. I would, at this point, normally I would go ahead and assess the other eye, but I'm just going to do one for the sake of this video. We already assessed his pupils and acuity and the cranial nerves test, so we don't need to do that at this point. Now I'm going to go ahead and assess your heart, okay, Grant? So go ahead and lie down. Go ahead and put your head over here. Alright, what I'm going to do is stand on the right of him, and I'm going to go ahead and feel for the PMI here. Alright, I'm going to go ahead and feel for the pulse. Okay, I found it. I'm going to try and localize it down to one finger. Alright, and I go ahead and found it. It's about at the 5th intercostal space, about the midclavicular line, which is an expected finding. I don't feel any pulsations or excessive heave. I don't feel any thrills, which is good. I'm not going to notice I didn't have him turn, because if I turn him, that might shift the PMI, which could be indicative of LVH or left ventricular hypertrophy. So, okay, Grant, you can go ahead and sit back up. I'm going to go ahead and listen to your heart sounds, okay? got a nice strong heartbeat. I'm just going to go ahead and listen to all the heart spaces. He's got a nice even rhythm. I don't hear any gallops or any murmurs, no adventitious sounds. I hear a nice steady S1, S2, and no other S sounds. I'm unable to say that he has normal sinus unless he was hooked up to a monitor, but he does have an even rate and rhythm. So that's good. At this point, Grant, I'm going to go ahead and assess your lungs, okay? So if you could just turn this way. And if you don't mind, could you mind taking off your shirt? I'm going to assess the posterior side first. Okay, first I'm going to go ahead and look at his thoracic cage configuration. His back is very symmetrical. It's an elliptical shape. His ribs are in a downward sloping angle here. First I'm going to test his symmetric expansion. So what I'm going to do, if you could turn slightly this way so the camera can see your back. Just a little bit right there. Sorry. Alright, so what I'm going to do is put my hands evenly like this. My thumbs are going to be about T9 or T10. Now what you're going to do, Grant, is just inhale and as deep as you can and exhale. And notice that my hands go up together, that one side didn't go up or the other side stay down, which is indicative of both lungs expanding normally. There's no collapsed lung or anything like that. Go ahead and do it one more time. Breathe in and breathe out. Alright, good. Thank you. Next thing we're going to do is what's called tactile fremitus, okay? So you can come back and face this way. Now what I'm going to do is I'm going to put the ulnar surface of my hands against his back like this, if you can sit up a little bit. And I want you to say, we either say blue moon or 99, which is a very vibratory sound to assess the vibrations. So go ahead and say blue moon in a deep voice.
Blue moon.
Alright, go ahead and go down.
Blue moon.
Go ahead and do it again.
Blue moon.
Again.
Blue moon.
And one more, deep.
Blue moon.
Okay, so what I'm feeling is equal vibrations bilaterally. One side isn't stronger than the other. An increase in vibrations could indicate consolidation, which could be indicative of having a disease process like pneumonia. If there was a decrease in the amount of vibrations, it could be indicative of an obstruction of the bronchus, such as a pleural effusion or emphysema, which is why we do this monitoring. Okay, so what we're going to do now is something called diaphragmatic excursion. Okay, Grant? So just turn a little bit this way so the camera can see you. Alright, so what I'm going to do is you're going to go ahead and breathe in, and then you're going to breathe out, and then take a deep breath in and hold it, okay? So what I'm going to do is I'm going to tap to hear the sounds. I learned this trick actually from my professor. That's easier to tap with this than just with your finger if you're still learning. So go ahead and breathe in, breathe out, and then take a deep breath and hold. Alright, and hold it. I'm listening to all the resonant sounds. Okay, breathe out. And this about right here is where I hear the dullness, which is hitting the diaphragm. So I'm going to go ahead and mark that. Alright, so now go ahead and breathe normally. Catch your breath. Then I want you to breathe out, breathe in, and then breathe out all of your air and hold it. You breathe out. Okay. Dull, 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 dull. And that's where I hear the resonance. Okay, you can breathe normally. I'm going to mark it there. And I'm going to measure the distance here with my little ruler. Awesome. So he has 7.5 centimeters for his diaphragmatic excursion, which is really good. 3 to 5 is typically normal, but you can have up to 7 to 8 for really well-conditioned people. So good job. You're well-conditioned, Grant. Okay. So next what we're going to do is I'm just going to percuss the rest of your back to see if it's all symmetrical and even. We already did a little bit. I would normally do both sides for the diaphragmatic excursion, but for the sake of the video, we're going to do one today. Resonant. Alright, so everything is good and resonant. You didn't feel any pain or tenderness on your back anywhere. Okay, and last thing I'm going to do is listen to his breath sounds. Yeah, go ahead and sit up. And then just every time I move my stethoscope, just go ahead and take a deep breath in and a deep breath out, okay? All right, breathe in and out. Make sure to get this side. And here. Alright, so good. All his breath sounds seem to be clear and even. I didn't hear any crackles or any rails or any adventitious sounds. Good lung expansion. Okay, pause. And now for the anterior side of the chest, we would do the same as assessing the posterior side, just to name what we did. We checked the thoracic cage configuration, the symmetry, the equal. We would also do a tactile fremitus. Again, on the anterior side, we would do the percussion and the auscultation, listening to the breath sounds as well. One thing I wanted to note is that his breathing is even and regular, it's unlabored, and he's not using any of his accessory muscles in order to breathe, so very good. Now we're going to go ahead and move on to the neurological system. We already assessed the cranial nerves earlier on in the beginning of the video, so we don't have to reassess that now. But first thing what I'm going to do is we're going to look at your cerebellar function. Okay, Grant? What that means is I'm going to have you do some different tests just to check that your cerebellum is working properly. So first thing is just taking your fingers, finger to nose, repeatedly. Okay, good. Also, the next thing to do is heel to shin. So taking your heel, dragging it down to your shin on both sides. It's very balanced and coordinated with no hesitations or awkwardness there. Next thing we're going to do is what's called rapid alternating movements. So what you're going to do is slap your hands, flipping them over like this on your knees as fast as you can. Okay, good. So he doesn't seem to have many hesitancies. Does it with ease, no problems there. It's good. Okay, so next thing we're going to do is something called stereognosis. What stereognosis is, he's going to have his eyes closed. I'm going to bring some common household objects to see if you can identify them with the absence of any visual information. So go ahead and close your eyes and hold out your hand. I'm going to give you one object and tell me if you can identify what it is. Go ahead and feel it. Can you tell me what it is?
It's a key.
It's a key. Good. We'll make sure you can see that it is a key. All right, close your eyes again. We have one more. Go ahead and feel it.
Paperclip.
Yep, it's a paperclip. It's an opened paperclip, but it is a paperclip nonetheless. So his stereognosis seems to be doing well. All right, next thing, Grant, we're going to go ahead and assess your reflexes, okay? We have a couple of them to do. First, we're going to start with the patellar. So go ahead and relax. Sometimes people get anxious, so go ahead and focus on squeezing your arms really, really tight. I'm going to go ahead and test your patellar reflexes here. Squeeze harder. Okay, there we go. We got it. All right, I would normally check bilaterally, but we're just going ahead and do one side for now. You can relax here. Next one we're going to do is the biceps. So I'm going to go ahead and have his arm bent a little bit like this. I'm going to squeeze right here. I'm going to hit my own thumb. Oh, that was good. About +2. His patellar reaction is about +2 as well. Next one we're going to do is the tricep. So go ahead and let his arm hang like this. I'm going to go ahead and strike in between this little notch right there. Okay, so go ahead and relax. Let me get that a little bit better. There you go. Had a little bit of twitch. +2. Okay, next one is the brachioradialis. So I'm going to come over and move this way. You can give me both of your thumbs. This way like this. What I'm going to do is I'm going to strike above this little radial notch. Okay? Okay, had a little bit of a twitch there, so that's a good reaction, +2 as well. Last one, or next to last one is the Achilles. This is going to be a little hard to see. I'll try to raise it up a little bit. So I'm going to hold his foot in a dorsiflex position while striking his Achilles tendon here. Okay, so what we saw, I don't know if you could see it in the video, is that his foot reacted by doing a plantar flexion, which is a normal expected finding. Last one, Grant, we're going to do is the Babinski reflex, which is normally assessed on babies, but we're going to go ahead and do this anyway. I'm going to take off your sock if you don't mind. I'm going to take the edge of my reflex thing and move upwards like this. Okay, good. He had a plantar flexion reaction, which is normal and expected finding. Go ahead and put your sock back on. It's a little chilly in here. All right, thank you. That is your reflexes. Next, we're going to just move on to the musculoskeletal system, okay? So, Grant, what we're going to do is I'm going to ask you to come up off the table. You could just, I'm going to get out of your way here. Just walk a little bit back and forth. Walk this way, turn around, go that way. Okay, go. So his gait is normal, steady, smooth, and even. He doesn't need any assistive devices. He seems to have full range of motion with that. Now, Grant, if you could go ahead and do the same thing, but walk from heel to toe. Okay, good. His balance is intact and coordination, no excessive swaying or loss of balance there. Okay, Grant, what we're going to do now, I'm going to ask you to do what's called a Romberg test. The Romberg test is where you stand with feet together. Go ahead and face the camera. Hands at your sides. Back up a little bit if you can. You're too tall. Now what we're going to do is close your eyes and try to stay standing upright. And I'm going to stand close enough to him just in case he starts to sway and fall. But if his neuromuscular functioning is intact, he shouldn't have any excessive swaying. I shouldn't need to catch him. Usually you test it for about 20 seconds. He seems to be doing good. No excessive swaying or excessive motion. Alright, looks like you're good. You can go ahead and sit down. I'm now going to test his hand grips to make sure that they're strong bilaterally. Alright, so I'm going to give you my fingers. Just go ahead and squeeze them. Okay, his grips are strong and equal bilaterally, but they're both equal in strength. Okay, you can let go. Go ahead and scoot back a little bit. I'm going to ask you to just press your feet against my hands as hard as you can. Okay, good. Both of his feet are pressing equally as strong bilaterally as well. And one more thing, if you go ahead and stand up again. What I'm going to ask you to do is if you can reach down and touch your toes as far as you can. It's okay if you can't reach all the way. Oh, wow, okay, he can reach all the way. All right, so his spine here is midline. There's no curvatures. Both of his muscles seem to be equal in size. You can go ahead and stand up. All right, last thing we're going to do is just test some range of motion, okay? So if you can, what we call abduction is when moving away from the body. Can you take your arms and move away from the body? Abduction. Adduction, moving back. And then what we call circumduction, going in a circle. All right, everything seems to be good, so you can go ahead and take a seat. That's it. Okay, now we're going to begin with doing the assessment of the abdominal system. We want to make sure that we assess with our eyes first, then we auscultate before we palpate, because any palpations could stimulate peristalsis, which could be a false indicator of bowel sounds. So first I'm just going to assess. You could go ahead and lay flat on the table. Alright, first I'm going to look at the contour of his abdomen, and if we look here, we see that his abdomen is flat, and flat here, no distension or any roundedness or anything like that, flat abdomen, so that's good. His abdomen is symmetrical with the musculature and the skin. Doesn't appear to be any lumps or lesions. His skin is pink and everything. So that looks good. His umbilicus is in midline. It is inverted. There's no discoloration, no swelling or anything like that. Next I'm going to do is listen to his bowel sounds, okay? So I'm going to start in the right lower quadrant, which is the ileocecal valve, because that's typically the most common place for hearing bowel sounds. If I did, in fact, not hear bowel sounds, I would have to listen for a good 5 to 10 minutes before being able to say that there was hypoactive bowel sounds, just to make sure. But I'm going to go ahead and listen. Grant, can you tell me the last time you ate?
An hour and a half ago.
About an hour and a half ago? Okay, so I'm going to move to this side so that the camera can see. I'm going to start in the right lower quadrant here. And I can tell that you just ate recently. You got nice gurgling going on, some high-pitched gurgles, cascading sounds. Moving all the quadrants here. Okay, so that's good. Go ahead and finishing up with that. Now I'm going to move on to percussion of the abdomen, okay, Grant? So I'm going to just go ahead and tap around to make sure that I can hear tympanies, what I'm expecting to hear, because normally when the patient is lying flat like this, air is going to be rising to the surface, and I should hear the air. I'm just going to percuss here. Good tympany sound. If I were to hear excessive dullness, I might suspect an obstruction or something like that. That's a nice sound right there. Good. Okay, Grant, next I'm going to go ahead and palpate the abdomen. I'm feeling for any lumps or masses. I might be able to feel an obstruction if he had one. Do you feel any pain or tenderness when I'm doing this? Mm-hmm. No? Okay. And I'm not feeling any masses or anything. I'm moving in a circular motion with the pads of my fingers in order not to poke him too badly. Okay, so that seems about good. Alright, if you go ahead and sit up for me, I'm going to test your CVA tenderness, or that stands for costovertebral angle. Normally, what this is testing for is his kidneys. If he were to have a kidney infection or something like that, he would probably jump off the table out in pain. So we're going to go ahead and test it, okay? So just let me know if you have any pain when I do this, okay? Anything? Good. And again, if he were to have pain, that could be indicative of a kidney infection. That's good. Okay, he'll go ahead and lay back down. I'm going to feel for your aorta, okay? So normally the aorta, you can feel it right above the umbilicus here, and it's usually about 2.5 to 4 centimeters. So I'm going to go ahead and measure it after I find it here. It's right there. Okay, measure that. And it's about 3 centimeters, so that's normal. That's good. All right, now if you'll go ahead and lift your knees up and put your feet flat. We do this when we assess the liver and spleen. So what I'm going to do first, Grant, is I'm going to check your liver border, okay? So what that entails is I'm going to get my wax pencil and my handy-dandy tool here, and I'm going to start in the resonance of the lungs and move my way down until I hear a shift to dull, which will be the liver. And then I'm going to mark that spot. Then I'm going to start down with the tympany of the abdomen and work my way up until, again, I have a shift to dull with the liver. And I'm going to mark that spot and measure the liver border to screening for hepatomegaly. And typically the distance is about 6 to 12 centimeters, so I'm going to go ahead and see what his is. I'm going to move to this side so you can see what I'm doing. I'm going to start here. Resonance, resonance. Alright, here's a shift to dull right there. I'm going to go ahead and mark that. And I'm going to start down here with the tympany of the abdomen and move up until I hear that shift to dullness again. It's a good tympany sound right there. And that's right where I hear a shift to dull. So I'm going to go ahead and mark that. I'm going to go ahead and measure it. Okay, and he has about a little just over 7 centimeters, which is in a normal range, which is 6 to 12 centimeters, so that's good. Alright, next, Grant, what I'm going to go ahead and do is I'm going to palpate your liver, which means to feel it, see if I can feel what it feels like, okay? So I'm going to make my hands in a V right over here, and as he breathes in, I'm going to go in, and as he breathes out and breathes in again, I'm going to go in deeper and see if I can feel the border or the edge of that liver, okay? So go ahead and breathe. Breathe in. I'm going in deeper. Okay. And I can just barely feel the edge of it there. Smooth and regular. I don't feel any irregularities on it. It's firm. Okay, good. And again, I am standing on the patient's right side. And I'm going to go ahead and now assess the spleen. So to do that, I'm going to move over to this side. You can just put your arm there. What I'm going to do is I'm going to take my finger, I'm going to find the lowest rib on the rib cage, then I'm going to slide my finger into that intercostal space, and then I'm going to percuss as he's breathing in and out, and there should be no shift to dull. If there is a shift to dull, that could be indicative of splenomegaly. So I'm going to go ahead and find that last rib here. Okay, put my finger in that intercostal space, and go ahead and breathe in and out. Okay, and I'm doing it and I'm not hearing any shift to dull, so that's good. That should be no indication of splenomegaly, and I'm not able to really palpate it, which is a good sign because normally you're not usually able to unless there's splenomegaly, so that's good. Okay, Grant, you can go ahead and sit up. Alright, you can come around and turn around this way. Alright, now we're going to go ahead and assess the reproductive system. For the sake of this video, we're just going to go over what I would normally do in a reproductive assessment. what we would do is I would feel for the inguinal nodes, which are right here near the femoral, where the pulses are. So we'd feel right in there, feel for any swelling or any pain or enlargement, and also teach him himself how to assess for that as well. Next, I would go over the importance of testicular self-exam, or TSE. We have a good acronym. You can remember how to assess yourself using the TSE acronym. T for time, which is about once a month you want to go ahead and assess yourself. S for shower, because the warmth of the shower helps the testicles to relax. And what your E stands for is examining. What you're examining for is any changes, any lumps that weren't there before, and to make sure to report any changes promptly to get screened for those. So that's how we would check the reproductive system, and that is all for the reproductive system.